We're getting an update today on what you need to know about COVID-19 vaccines for children locally. With more on this is Dr. Mark Kline with Children's Hospital LSU Health. Dr. Kline, good afternoon and thanks for being with us.
Thanks so much for having me.
So, Dr. Kline, there is now a new group eligible for COVID-19 vaccines. Let's talk about who or what age group is now eligible.
Yeah, well, just about a week and a half ago, the Food and Drug Administration gave emergency use authorization for 2 vaccines for children under 5 years of age. So children 6 months to 5 years now for the first time are eligible for vaccination. And the 2 shots are Moderna and Pfizer.
And of course, those shots, the same makeup as far as what is in the shot, but the dosage is different for this age group. Can we talk about, I know, and it may vary based on the Pfizer and the Moderna, but generally speaking, what's the sizing difference on this shot compared to older children and then adults?
Yeah, well, the dose is entirely different. The vaccine preparation, as you said, is exactly the same, but the dose itself is a fraction of what is given to older children and adults. So it's important that for children under 5 that they get the vaccine that is specifically recommended for that age group.
And Dr. Kline, I'm sure there are still lots of parents out there hesitant to get their, especially this small of a child, vaccinated. What would your piece of advice be to them now that this vaccine is available for this age group?
Well, there is some hesitancy, and I think we all understand that. Parents are very cautious where their young children are concerned, and they certainly don't want to give a vaccine that hasn't been studied and isn't safe and effective. But in the case of these 2 vaccines, they've been through very rigorous clinical trials. No corners were cut at all, and they were found to be very safe in this age group and effective at producing antibodies that can keep the child out of the hospital, or worse yet, even prevent them from dying. So I'm very confident in recommending both of the vaccines, and I think it's a good thing to vaccinate all children in this age group.
Now, Dr. Kline, for parents who are looking into this, maybe they want to go talk to a pharmacist or doctor right away, where can they go to find these vaccines, and how soon can they go get them? Or can they go right now if they wanted to?
The vaccines are available right now, and probably the easiest thing to do is to go online to chnola.org, CHNOLA for Children's Hospital New Orleans.org, and all of the information you need is right there. We've administered or have appointments for about 182 children already, so as we speak, children are getting the vaccine, and we have a lot of open slots, so we're eager to vaccinate even more children.
All right, Dr. Mark Kline with Children's Hospital, we appreciate your time this afternoon.
Thank you.